A 64-year-old male presents with a progressive cough, shortness of breath, and mild hemoptysis. I am showing you his frontal chest radiograph and an axial contrast enhanced chest computed tomography scan. Describe the findings.
The frontal chest radiograph demonstrates a hazy opacity in the upper and mid-lung zones on left side, with elevation of the ipsilateral hilum.
State your primary diagnosis and name the two classic signs demonstrated on the chest radiograph.
The primary diagnosis is lobar collapse secondary to an obstructing bronchogenic carcinoma. The two classic signs are the Luftsichel sign and the golden S sign, also known as the S-curve of Golden.
If I tell you the patient has a 60-pack-year smoking history, what is the most likely histological cell type?
Given the strong association with heavy smoking and the central endobronchial location, the most likely cell type is squamous cell carcinoma of the lung.
Explain the anatomical origin and imaging appearance of the Luftsichel sign.
The Luftsichel sign represents a sickle-shaped crescent of air surrounding the aortic arch. It occurs in left upper lobe collapse when the hyperinflated superior segment of the left lower lobe herniates anteriorly and superiorly, positioning itself between the collapsed lobe and the aortic arch.
Describe the components of the golden S sign and what it indicates.
The golden S sign is formed by the major fissure being pulled superiorly and anteriorly by the collapsed lobe, while the central obstructing hilum mass prevents complete retraction, creating a bulge. This creates a reverse S shape, which indicates that the collapse is caused by a central obstructing mass.
Name 5 tumors that can affect the central airways in adults.
The 5 tumors are bronchogenic carcinoma, carcinoid tumor, adenoid cystic carcinoma, mucoepidermoid carcinoma, and endobronchial metastasis, typically from renal cell carcinoma, breast cancer, or colorectal cancer.
Compare the typical computed tomography growth patterns of squamous cell carcinoma and small cell carcinoma of the lung.
Squamous cell carcinoma typically grows endobronchially as a discrete, lobulated mass, leading to early airway obstruction and atelectasis. Small cell carcinoma typically grows submucosally and parabronchially, presenting as a large, infiltrating mediastinal mass that encases and extrinsically compresses the airways.
What is the typical location and radiological presentation of pulmonary adenocarcinoma?
Adenocarcinoma typically presents as a peripheral lung nodule or mass, which may exhibit spiculated borders, pleural puckering, or a ground glass component, and it is less commonly associated with central airway obstruction.
According to the current 8th edition tumor node metastases staging system, how does post-obstructive atelectasis affect the T stage of non-small cell lung cancer?
Under the current 8th edition classification, post-obstructive atelectasis or obstructive pneumonitis involving either part of the lung or the entire lung is staged as T2, provided other T3, T4 criteria are not met.
State the critical safety warnings and the immediate management recommendations for a patient with central airway obstruction.
The critical safety warnings are post-obstructive pneumonia leading to sepsis and acute airway occlusion. Radiologists must immediately recommend urgent flexible bronchoscopy and biopsy for tissue diagnosis. Suggest intravenous broad-spectrum antibiotics if signs of infection develop, and advise urgent thoracic surgery or chest medicine referral for airway clearance or stenting.